Hello, I'm here to talk to you today about a family nursing theory called the Family Management Style Framework. My name is Leilani Ferrer. I am currently a psychiatric nurse practitioner student at the University of Nevada, Las Vegas, and a full-time ER nurse at St. Rose Dominican Hospital in Henderson, where I've worked over the last 12 years. My nursing background has been mostly emergency nursing with a few years of ICU since the year 2000. In discussing the family management style framework, I will discuss the key concepts involved, give you some definitions that the theorists used in describing the framework. I will also tell you how the framework is used in family nursing practice currently and previously, and lastly, I'll talk about some research projects guided by the theory. The Family Management Style Framework was introduced over 3 decades ago in 1990 by Drs. Kathleen Naffel and Janet Dietrich, and had since been refined and updated with versions in both 2003 and 2012. It is a well-established framework of family response to chronic condition care of children and to families caring for older adults with dementia. It was designed to help nurses understand how families integrate the management of the chronic illness for the child into the everyday living needs and routines of the family as a whole. Dr. Snaffel and Dietrich originally identified 5 family management styles, although many others have been identified. For example, a published study by Dr. Ann Krause in 2002, as well as a published study by Dr. Wiegand et al. In 2008, show several other family management styles that were not originally identified. The 5 management styles originally identified are listed here. The Family Management Style Framework has 3 significant components, with the first one being the parent's view of the child. This first component has 4 dimensions, which look at how the parents define the child's chronic condition. How is the child viewed by the parents? For example, is the child viewed as someone whose health issue can be managed, or someone whose condition is tragic and unmanageable? What are the parents' personal beliefs about the whats, the hows, and the whys of the child's condition? And how do they view the seriousness, predictability, and the course of the chronic condition? Lastly, this component looks at parental mutuality. How similar are the parents' perceptions on how they view their child and how they will manage the situation? The second component, management behaviors, has 2 dimensions that look at parenting philosophy, where the parents look at their beliefs about their ability to care for a child with a chronic condition, and their management approach. Are they confident in their ability to manage the child's condition? Or do they view the child and the situation as taxing or difficult? Or do they feel short and insufficient to care for their child? The last component, the perceived consequences, are actual or expected outcomes that shape management behaviors that affect the subsequent definition of the situation. Is the family focused mainly on the chronic condition, or is it only an aspect of family life balanced with other responsibilities? Family is defined as the person with a chronic condition and the individual family members. This may also include extended family members and caregivers. Health is implied as the lack of a chronic condition. The environment is defined as the home, hospital setting, community setting, or school. It may also be defined as the contextual influences such as the social network, access to resources, and interchanges with healthcare and school systems. Nursing is defined as intervening to help a family in the management of adaptation to living with a chronic condition. Nursing will involve assessing care needs, providing education, and offering counseling. The Family Management Style Framework has been useful in describing the processes that families experience the way they manage care challenges, and family response patterns. It has been applicable to varying healthcare challenges across the lifespan, with studies on children as well as adults. The framework directs attention to the intersection of condition management and family life. It allows nurses to understand families and to offer interventions to meet their needs. The framework helps identify unique family needs and serves as a useful guideline for nurses. Lastly, it helps develop interventions to support families in managing the situation and adapting to it. Two recently published research studies guided by the Family Management Style Framework were identified. In 2017, Raymond et al. Published a study on parents caring for adult children with serious mental illness. The study describes the parents' perspectives on managing the care of their adult child with a serious mental illness. The study design used is qualitative. 4 major themes emerged from the data, describing prolonged and difficult phases that parents and the family undergo in caring for an adult child with a serious mental illness. The study concludes by saying that successful management of these phases must include increasing access to mental health information, mental health screening, early interventions, and violence prevention for adult children and their families. In 2019, Sangiacomo et al. Published a study describing the family management challenges facing families of childhood brain tumors. They used secondary analysis data from qualitative interviews and concluded with identifying 7 core challenges to family management. These challenges may be used as guidelines to help provide targeted education, psychosocial support, and anticipatory guidance to assist with the decision-making, intervention, and advocacy. So, why did I choose this theory? I know that the theory has been applied to families dealing with dementia, and the family I'm working with is going through a lot with a new diagnosis of dementia. The Family Management Style Framework will allow me to understand their needs, which would assist me in offering effective interventions to meet those needs. Listed here are the references I used in completing this project. Thank you for taking the time to listen to my presentation.